In children, we most often use the blue cannula. Okay, in older children, we can even use the green or pink cannula, especially if the child has got severe blood loss, is in shock, or needs aggressive fluid resuscitation. We prefer wider bore cannulae. Hello friends, in this video we'll be discussing about a very important procedure, that is IV cannula insertion, how it is done in neonates or children. The process remains the same whether you do it in a neonate or children. So we'll see what are the exact steps that need to be followed, what are the different parts of IV cannula and the things that we need to keep in mind. So before going to the procedure, let us see what are the different types of cannula that are available. So the color coding of IV cannula is followed universally same everywhere, and you get questions related to it as well. So you need to know which color cannula is what size and what is it used for. Okay. So there's a mnemonic which you can use to remember the different sizes of the cannula based on their colors. So, oh great God, please bless your people. All right. So, oh is the first one. So the largest IV cannula size that is there is the orange one. So orange colored cannula is 14 gauge. All right. Then you have the oh great God. So after orange, two G's, great God. So gray and then green. So this gray colored cannula you can see. Okay, so this gray colored cannula is 16 gauge. All right. Then you have the green colored cannula which is 18 gauge. Right. Oh great God, bless your people. Please bless your people. So please is for pink. So this pink cannula is 20 gauge. Bless your people. So blue cannula is 22 gauge. Yellow is 24 gauge. All right. And purple is the smallest one, which is used in preterm neonates and neonates with difficult vascular access. And this is the 26 gauge cannula that is available, right? So we need to know this color coding. In children, we most often use the blue cannula. Okay, in older children, we can even use the green or pink cannula, especially if the child has got severe blood loss, is in shock, or needs aggressive fluid resuscitation. We prefer wider bore cannulae. And for neonates and infants, we usually use yellow cannula, and purple cannula is used in preterm neonates or in neonates with difficult vascular access. Okay. Now the dictum or rule of the thumb is whenever you're using IV cannula, use the smallest possible caliber which is required for that age group for that particular indication. Because if the cannula size is too big and is almost of the size of the vessel, then the blood flow in that vessel may get hampered, and there can be endothelial injury as well. So more chances of thrombosis will be there. So make sure you select the correct size of cannula based on the age of the patient and the indication and various other factors, of course, like feasibility, the size of the vein that is available, and whether the child has been pricked multiple times. Then again, securing a vascular access might become all the more difficult. All right. Now, what are the parts of a IV cannula? So you can see that this is a IV cannula. So here, this is a IV cannula. This is the gray colored cannula that we talked about. So gray colored we said is 16 gauge, right? So this gray colored cannula, so on the cannula, when the cannula comes in the packet, there is a plastic sheath which you remove before using. And then you can see these are the two wings that are there, which are used to hold the cannula so that, easy access is possible, and it is also useful in fixing the cannula. Okay, you need to secure it with tapes around it. So the parts of a cannula are basically, there is an outer polythene sheath. So this is the outer polythene sheath you can see. All right. And this is the inner metallic stellate. So this inner metallic stellate is there inside this outer polythene sheath, and these are the wings we said. This is a opening from which the drugs can be pushed inside. It is covered by the color coded cap you can see here. All right. And here on behind the stellate there is one cap, removable cap, which you can use to put here or to put on the end of the cannula once you have removed the stylus. So once you've taken out the metallic stylus, so what you do is you secure this outer end with a cap so that blood loss doesn't occur. Right? Now let us see how exactly the cannula insertion is done. So here we'll be looking at the cannula insertion in a neonate. So we'll be using a yellow cannula, which is 24 gauge, right? So what are the things that we need for cannula insertion? You can see a sterile pair of gloves. So then you have the tape to fix the cannula. Of course, you need the the cannula of appropriate size. Okay, so IV cannula, you can see that the yellow one is 24 gauge. And as we said, we are doing it in a neonate. So we also keep one lesser size ready. So purple one, 26 gauge in case we need it. Alright. Now before putting cannula, you have to use clean the area using spirit and betadine swabs. So very important. And some, you have to keep a syringe ready with normal saline or distilled water in it, sterile syringe for flushing the cannula to see. So flush helps in seeing whether the cannula is in appropriate place. And of course, it also helps in cleaning up the cannula so that stagnant blood is not there, lesser chances of thrombus formation inside it. Alright. So keep all these supplies ready before putting a cannula. And you have to do hand washing, following all the proper steps of hand washing using a liquid soap before putting a cannula, as it is an invasive procedure. Put on sterile pair of gloves after that. Take informed consent from the parents of the baby, okay? And make sure that you have a proper indication for which you're going to put an IV cannula. Now, before putting a cannula, it is very important to select the appropriate part of the vein where you're wanting to put the cannula. So, search for a straight and prominent vein. Okay, it can be in the upper limb, it can be in a lower limb. So, the vein, the part of the vein where you're wanting to put the cannula should be relatively straight and free from any branches. Once you've identified it, like here you can see in front of the medial malleolus, we have identified one vein. So, you clean that area first with spirit, then let it dry. Okay, then we clean it with a betadine soaked cotton swab. And whenever we are cleaning, start from the area where you intend to puncture and then clean on the periphery of it. Okay, so that the area remains absolutely clean. Okay, and then again with spirit swab, let it dry. So spirit, betadine spirit, we cleaned it and let it dry. Then you have to ask one nursing assistant or one nursing staff or a friend or colleague of yours to hold the limb of the baby steady. That is important one, because the baby will keep on the limbs moving, and holding it will also make the vein more prominent. As you are obstructing the blood flow, the blood will accumulate there and will make the vein more prominent. All right, so you take out, with the help of your colleague, you take out the cannula from the packing. Okay, and hold it in your sterile gloved hands. Don't keep the cannula anywhere. Okay, strict asepsis needs to be maintained. So make the vein prominent. And it is very difficult to secure vascular access in neonates and children. So it's not necessary that you succeed in first attempt. So keeping the beveled end of the cannula up, you make an angle of around 30 degrees. Okay. So if you're not successful, you can, change the angle a little bit and then insert the cannula. So as soon as you see a drop of blood coming in the hub of the cannula, that means you've reached. So you can see a drop of blood behind the cannula here, okay, in the hub. That means the cannula is inside the vein. And you can also see that free flowing blood is coming from the hub or the rear end of the cannula. That means your cannula is in C2. Now, before fixing the cannula, just ensure that the cannula is in position. Okay. And if you want to do any blood sampling, we use this cannula to do blood sampling from the neonates and children also. So in neonates, it is not easy. Just like in adults, you put a syringe and take out the blood sample. It's not like that. So we use either a needle or a cannula in a vein, and drop by drop, you can see how precious is the blood that we collect. Okay. So, we have to collect it very patiently, drop by drop, in whatever container or, for whatever investigation we want the blood. You need to be very patient and collect it drop by drop, and then flush the cannula once you are done. So this flushing will clear the cannula off also. And while you are flushing, just make sure that there is no swelling which is occurring. Okay, because if there swelling is there, that means some counterpuncture has occurred. Now, once you're sure that the venous cannula is in C2, just put the cap behind the cannula and then clean the area around it once again, so that no blood remains there, because blood is a very good culture medium. If blood is there, the site can easily get infected and become dirty as well. Alright. So you can see our cannula is well inside the vein now, and there is no swelling that has occurred despite the flush that we have used. So now we are going to fix this cannula. So preferably use transparent sticking to stick the cannula. Okay, if that is not available, you can use whatever sticking tape that is available for you. Okay, so when you are fixing the cannula, just make sure that you are fixing it very nicely and properly. The area is not wet when you are fixing it. It has to dry only, then the skin has to dry only, then you paste your sticking, otherwise it can come off easily. Okay, and better is on the sticking that you've used, if you can write the date and time on which you have put the cannula, then that is also good to know that you know how many days that has been used. Although there is no hard and fast rule that a cannula can be used for 2 days or 3 days or 4 days or 5 days only. You can use it as long as the indication for IV access exists, and as long as it is patent and free flowing and there is no swelling and all, or no evidence of thrombophlebitis. So you can see we have fixed the cannula here. If required, you can also put a splint to immobilize the joint, okay, if required. And if it is not required, you can just leave it as such also, all right. Apart from that, you have to check multiple times every day to see whether any thrombophlebitis has developed or not. So there is a score that is used for checking for thrombophlebitis, that is the VIP score that may be asked for you. Visual Infusion Phlebitis Score, or VIP score, wherein the cannula site can be given a score of 0 to 5. 0 means the IV site is healthy. 5 means there is, severe thrombophlebitis, redness, swelling, induration, and the vein has become cord-like and palpable. So if the VIP score is 2 to 5, you need to change the cannula site, okay, and put it in some other site. And 5 is the most severe VIP score wherein some action needs to be taken, okay, for thrombophlebitis. So that is how you insert IV cannula in neonates and children. You need to be very, very patient, because securing IV access is definitely, though it is one of the most commonly performed procedures, but in a child or neonate, it can really be tricky and taxing. Even the best of the persons who are most experienced can also, fail sometimes while putting a cannula in neonates, infants, or children. So, a lot of patience is required, and of course, practice is required to sharpen any skill. And you need to follow these precautions and strict asepsis as we discussed. And after putting the cannula, the care that you give, how you fix it, how you use it, how you handle it aseptically, and prevent thrombophlebitis and detect it at its earliest and take appropriate action. So all that needs to be kept in mind for regarding IV cannula and its insertion in children.